You are in recess. The patient is crashing. You have seconds, not minutes, to reach for the right drug, give the right dose, and make the right call. This video covers the 10 emergency drugs every medical professional needs to know cold. Their class, their indications, their doses, and how to say them. Because in a real emergency, clarity saves lives. Let's go. Adrenaline, epinephrine. Our first drug is adrenaline. In American English, this drug is called epinephrine. They are exactly the same drug. If you work in an international environment, you need to know both names. So, what is adrenaline? Adrenaline is a sympathomimetic drug. This means it mimics the effect of your sympathetic nervous system, your body's emergency response system. More specifically, it is an alpha and beta adrenergic agonist. It works on receptors throughout the body, in the heart, the blood vessels, and the lungs. When do we use it? Number 1, cardiac arrest. When the heart has stopped, adrenaline is given to stimulate it and improve blood flow to the brain and heart muscle. Number 2, anaphylaxis. This is a severe, life-threatening allergic reaction. Adrenaline is the first-line treatment. Nothing else comes first. Number 3, severe asthma that has not responded to other treatments. One important note, the concentration matters enormously. 1 in 1,000 for intramuscular injection, 1 in 10,000 for intravenous use. Confusing these two can be fatal. Drug number 2 is atropine. Atropine belongs to a class of drugs called anticholinergics. These drugs block a chemical messenger called acetylcholine. The result, the heart beats faster, secretions decrease, and smooth muscle relaxes. When do we use atropine in an emergency? The main indication is severe bradycardia. Bradycardia means a slow heart rate. When the heart beats too slowly, blood pressure drops and organs are not perfused adequately. Atropine speeds the heart up. Atropine is also used in organophosphate poisoning, for example from pesticides or certain nerve agents. These toxins cause the body to produce excessive secretions. Atropine blocks this effect. One key phrase to remember: titrate to effect. In organophosphate poisoning, you keep giving atropine until the secretions dry up: saliva, bronchial secretions, sweat. The dose can be very large. Drug number 3 is amiodarone. This is one of the most commonly mispronounced drug names in clinical English. Amiodarone. Amiodarone is a class 3 antiarrhythmic drug. It works by slowing electrical conduction through the heart, particularly through a structure called the atrioventricular node, or AV node. In an emergency, amiodarone is used for life-threatening arrhythmias, unstable heart rhythms that threaten life. The most important situation, ventricular fibrillation or pulseless ventricular tachycardia during cardiac arrest, when defibrillation shocks alone are not enough. Outside of cardiac arrest, it is used for stable ventricular tachycardia and atrial fibrillation with a fast ventricular rate. Drug number 4 is morphine. Morphine is an opioid analgesic. The word analgesic means pain relieving. Morphine is the reference opioid, the standard against which other pain medications are compared. It works by binding to receptors in the brain and spinal cord called mu-opioid receptors. The result is powerful pain relief, sedation, and a reduction in anxiety. In an emergency, morphine is used for severe acute pain, for example in myocardial infarction, a heart attack, in major trauma, and in renal or biliary colic. Important: morphine must be given carefully. It can cause respiratory depression, a dangerous slowing of breathing. Always have the reversal agent ready. We will cover that in the next drug. Naloxone. If morphine is the drug that can stop breathing, naloxone is the drug that reverses it. Naloxone is a pure opioid antagonist. Naloxone competes with opioids at the receptor and wins. The clinical picture that tells you to give naloxone: a patient who is unconscious or deeply sedated, with a very slow respiratory rate, below 10 breaths per minute, and with pinpoint pupils. This is the classic presentation of opioid overdose. One critical point: naloxone wears off faster than most opioids. The patient may wake up and then become sedated again 30 to 90 minutes later. This is called resuscitation. Always monitor the patient after giving naloxone. A useful English phrase for this situation is, the patient is unresponsive with pinpoint pupils and a respiratory rate of 6. This is the sentence that should immediately make you think, opioid overdose, give naloxone. Number 6. Midazolam. Midazolam is a benzodiazepine. Benzodiazepines are a class of drugs that calm the central nervous system. Midazolam is the short-acting member of this class. It works by enhancing a calming chemical in the brain called GABA. The result: sedation, anxiety relief, muscle relaxation, prevention of seizures, and, importantly, anterograde amnesia. This means the patient will not remember what happened during the procedure. 3 main emergency uses. First, status epilepticus. This is a prolonged seizure that does not stop on its own. When intravenous access is not available, particularly in children, midazolam can be given into the cheek, buccally. Second, procedural sedation, for painful procedures like cardioversion, fracture reduction, or wound management. Third, part of rapid sequence induction, the technique for emergency intubation. Number 7. Hydrocortisone. Hydrocortisone is a corticosteroid. It is the synthetic form of cortisol, the hormone your adrenal glands produce naturally in response to stress. It has powerful anti-inflammatory and immunosuppressive effects. In emergency medicine, hydrocortisone has 3 main uses. First, anaphylaxis. After adrenaline, the first treatment, hydrocortisone is given to prevent what we call a biphasic reaction. This is a second wave of the allergic reaction that can occur hours later. Hydrocortisone does not work immediately. It takes 4 to 6 hours, but it is important for prevention. Second, acute severe asthma. Hydrocortisone reduces airway inflammation and helps open the airways over several hours. Third, adrenal crisis, also called Addisonian crisis. Addisonian. When the adrenal glands fail suddenly, blood pressure collapses. Hydrocortisone given intravenously, immediately, is life-saving. Number 8. Furosemide. Furosemide is a loop diuretic. A diuretic, is a drug that increases urine production. Furosemide is called a loop diuretic because it works in a specific part of the kidney called the loop of Henle. It produces a rapid, powerful effect. The main emergency use is acute pulmonary edema. Pulmonary edema means fluid in the lungs. This occurs most commonly in acute heart failure. Furosemide removes this fluid through the kidneys, and it also dilates the veins, reducing the workload on the heart within minutes of injection. It is also used in fluid overload from kidney failure or liver cirrhosis, and as an adjunct in hyperkalemia, high potassium levels in the blood. Key vocabulary. Electrolytes are minerals in the blood, such as potassium, sodium, and magnesium. Furosemide removes water and these minerals along with it. Always check and replace them. 9. Dextrose 50%. Dextrose is another name for glucose, the sugar your brain depends on. When blood glucose falls dangerously low, the brain is deprived of its fuel. The result? Confusion, seizures, unconsciousness. This condition is called hypoglycemia. Hypo means low. Glycemia refers to glucose in the blood. It is one of the most common and most treatable emergencies in medicine. 50% dextrose is a highly concentrated glucose solution. It raises blood glucose rapidly when given directly into a vein. Important warning: 50% dextrose is hypertonic. This means it is very concentrated and can damage the vein wall if it leaks out. Always use a large vein and confirm your intravenous access before injecting. A helpful English abbreviation: BM. This stands for blood glucose measurement. You will often hear clinicians say the BM is 2.1, meaning the blood glucose is 2.1 millimoles per liter. Normal range, 4 to 7 millimoles per liter. 10. Our final drug, succinylcholine or succinylcholine in American English. This drug is a depolarizing neuromuscular blocking agent. A neuromuscular blocking agent, sometimes called a muscle relaxant, causes complete paralysis of all skeletal muscles. This is not the same as sedation. The patient may still be conscious but cannot move or breathe independently. Succinylcholine is used in a procedure called rapid sequence induction, often abbreviated as RSI. This is the technique for emergency intubation, inserting a breathing tube, in a patient who is at risk of inhaling stomach contents into the lungs. This risk is called aspiration. In RSI, you give a sedative drug, for example ketamine or propofol, and then immediately follow it with succinylcholine. Within 60 seconds, the muscles are relaxed and intubation conditions are optimal. Why succinylcholine specifically? Because it works fast, onset in 60 seconds, and wears off fast, duration of 10 to 15 minutes. If intubation fails, the patient will start breathing again relatively quickly. However, there are important contraindications. Succinylcholine causes potassium to be released from muscle cells into the blood. In some patients, this release is massive and can cause fatal hyperkalemia, dangerously high potassium levels. These patients include those with severe burns after 24 hours, crush injuries, prolonged immobility, and certain neuromuscular diseases. In these patients, use rocuronium instead. Rocuronium is a non-depolarizing agent that can be reversed with sugammadex. That is all 10 emergency drugs. Let's review them quickly. Adrenaline for cardiac arrest and anaphylaxis. Atropine for severe bradycardia. Amiodarone for life-threatening arrhythmias. Morphine for severe pain. Naloxone to reverse opioid overdose. Midazolam for seizures and sedation. Hydrocortisone for anaphylaxis, asthma, and adrenal crisis. Furosemide for pulmonary edema and fluid overload. Dextrose 50% for hypoglycemia. Succinylcholine for emergency intubation. If English is not your first language and you're using this video to study medical English, here is my advice. Don't just watch. Say the drug names out loud. Repeat the dose sentences. Pause the video and describe what each drug does, in English, to yourself. Comment "pill" and I'll send you PDF with exercises to practice these 10 drugs. If this video was useful, please like it and subscribe. Part 2 covers the next 10 emergency drugs, cardiovascular and shock management. Follow for more Medical English Pro.